So let's move on to the infections affecting the brain parenchyma. So when meninges is being involved, it is called as meningitis, while if the brain parenchyma is being involved, it is called as encephalitis. So various infections are cytomegalovirus. So CMV virus, it is commonly going to cause infection in the immunocompromised individuals. And suppose if the patient is a kid, so in utero infection, if the kid has been infected from the mother, then the kid will present with periventricular necrosis and calcification along with a microcephaly. So these three features are classical of CMV infection in utero. So the infant will have periventricular necrosis, calcification and microcephaly. In immunocompromise, it will usually present with a hemorrhagic necrotizing encephalitis. So most of the viral infections will present with hemorrhagic necrotizing encephalitis. And the classical feature of cytomegalovirus will be, as the name suggests, cytomegalo. So the cell is enlarged. This is what they mean. So the enlarged cell will be there, nucleus will be enlarged, and the characteristic thing will be the intranuclear and intracytoplasmic basophilic inclusions. Okay. So in this image, if you see, this is the nucleus. So this thing is the nucleus, and the cell was this. This red color is the cell, the black colored I had outlined will be the nucleus, and inside that, if you see, this entire thing is the intranuclear inclusion. So the inclusion here is basophilic. That is what is very important, because we had seen other cells wherein you have eosinophilic inclusion, like Reed-Sternberg cell. So in Hodgkin's lymphoma, you get a giant cell called as Reed-Sternberg cell, wherein again you can have this perinuclear halo, but the perinuclear halo and the prominent eosinophilic nucleoli. So there the nucleoli is there. It is not an inclusion. It is an nucleoli which is eosinophilic. Here it is an inclusion which is basophilic. Same goes for measles Warthin-Fingalti giant cell also. There again you had intranuclear inclusions, but there it was a eosinophilic inclusion. So the only basophilic inclusion you need to remember will be a CMV basophilic inclusion. And doesn't it look like an owl eye? So like a Reed-Sternberg cell, a CMV kind of infected cell is also called as an owl eye appearance because of their perinuclear halo with their inclusion. Next, we'll see about herpes simplex infection. So, herpes simplex encephalitis again presents with hemorrhagic necrotizing encephalitis affecting the frontotemporal lobes. So, both children and adults can be affected in this. And here, there will be Cowdery type A intranuclear inclusions. So, any type of herpes will have the Cowdery inclusions like. So, here it will be Cowdery type A intranuclear inclusions. Okay, intranuclear. Then rabies. So, rabies we are all familiar with. It is caused due to a rabid dog bite. So, after that, the patient will develop severe encephalitis. So, there will be a history of dog bite, and then within 1 to 3 months, the patient will start having symptoms like hydrophobia and then paralysis. And because of paralysis, respiratory muscles can also undergo paralysis, and that will lead to respiratory failure and death. So, the most common sites affected here will be from the site of infection, that is from the site of bite, the virus will travel upward and it will reach the brain. So, it is going to affect the brainstem, basal ganglia and midbrain, and the most severely affected will be the brainstem. So, most severely affected region in the rabies infection will be the brainstem. What are the classical features we see in a rabies infection microscopy? So, Negri bodies. We are all familiar with this name, right? So, Negri body. So, Negri bodies are usually present in the pyramidal cells of the hippocampus and Purkinje cells of the cerebellum. So, both the P's. Remember P and P. So, this image is that of the cerebellum. So, this is an cerebellum wherein this is the Purkinje cell, which is looking like a flame shape. So, here if you see, this is the nucleus of the cell, and if I zoom it here, can you appreciate that there is an inclusion over here? So, the cell is like this with the nucleus, and there is a small inclusion. So, this kind of eosinophilic cytoplasmic inclusions will be present, and those are called as Negri bodies in rabies. So, in brain, we'll be reading about many inclusions. So, remember, I'll club together at last also, but still remember it now. Next, we'll see about HIV infection. So, HIV infection, again, it is part of AIDS dementia complex. You will get a cognitive impairment. So, in AIDS dementia complex, usually the cortex is paired while the subcortex is usually involved. And in HIV encephalitis, the classical microscopic feature will be that of a microglial nodules. So, microglia are nothing but modified macrophages in the brain. So microglia, they are going to form some nodules, and this exact image has also been asked before. So this is the microglial nodule, in which you can appreciate this is a giant cell over here, this is a giant cell over here, this is a giant cell over here, and rest all cells are just microglial clusters. So here there will also be necrosis and surrounding reactive gliosis as well. But the most important thing about this here is HIV will not have any vasculitis association, nor it will have any inclusions associated. So the classical feature you see in HIV will be a microglial nodule. Next, moving on to cryptococcal infection. Cryptococcus is the most common fungal infection, and here it can cause both fungal meningitis as well as encephalitis also. And here again, immunocompromised people are more susceptible for cryptococcal infection, and cryptococcus is a fungus which has a capsule. So based on this capsule only, the diagnosis of cryptococcus is made. So it's very important. So grossly, it appears like soap bubble abscess. So here if you appreciate, there are multiple small abscesses. So all of these appear like soap bubbles, and the soap bubble appearance is basically due to the capsule of the cryptococcal organism. So soap bubble abscesses is due to the cryptococcal infection, and usually it affects the Virchow-Robin space. Virchow-Robin space are nothing but perivascular spaces in the brain. So Virchow-Robin spaces are affected in cryptococcal infection. So on microscopy, if you see, again on microscopy it appears like soap bubble. So all of these cells, if you see, this is a cell, and here you see this organism. So the organism here, this is the organism, and it appears that there is a center part, and surrounding it there is an unstained capsular part. So the unstained capsular part, capsule needs to be stained by special stain. So there is an unstained capsular part and the center dark stained part. So that looks like a soap bubble, and that is why it is called as soap bubble cysts. So how do you highlight this capsule of this cryptococcus? Using special stains like mucicarmine. Very important. Mucicarmine stain highlights the capsule of cryptococcus. And here if you again see, so this dark pink colored, magenta pink colored capsule is being stained, and that again looks like a soap bubble. So soap bubble appearance, always remember cryptococcus. Soap bubble appearance for cryptococcus. Then we'll see about mucor and aspergillus. These are again fungal organisms which are known to invade the blood vessels. Since they invade the blood vessels, they are very bad and they can disseminate and even cause intracranial spread. Usually they infect the ENT. So nasal sinuses can be affected, and from there it can reach up to the brain easily. Okay. So even during COVID times, we had lots of cases of this mucor and aspergillus because of immunocompromised status. So mucor, the first image is mucor. So how do you differentiate between mucor and aspergillus? Mucor is going to be an aseptate broad fungus which has a perpendicular branching like this. So in this image, if you appreciate, these are quite broad, right? And they are having branching also in between. So here if you see, it is a 90-degree branching and there is no septate in between. So this is how a mucor appears. And the special stain used for identifying fungal organisms is usually periodic acid Schiff, and the PAS stain usually stains other things also. So kind of specifically we can use Gomery's methenamine silver. So GMS stain is Gomery's methenamine silver stain. So any silver stain will highlight the thing in black. Okay, so the fungal organism is going to appear black and the background is going to appear somewhat cyan blue. Okay. So this is the mucor organism highlighted in the GMS stain. So nextly, aspergillus, it is going to appear thin and it is going to be septate with an acute angular branching. So it will have acute angle branching and it will have lots of septae also. So septae is going to be present. So this is the appearance of a aspergillus. And here in this again, if you see, there is Gomery's methenamine stain which is highlighting this thin septate hyphae. Okay.